this video is to show you the skill of tracheostomy care. As always, when entering a patient's room, we want to knock and introduce ourselves. We also want to identify the patient with two forms of identification. In trach care, we always want to explain the procedure and ensure the patient understands. If we are unsure, we need to establish a means of communication to ensure the patient can communicate any problems or complaints or issues during the procedure. We want to monitor the patient's oxygen sats during tracheostomy care. So we'll always want to use a pulse oximeter and place it on the patient's finger so that we can monitor during the procedure. We want to listen to the patient's lungs prior to and after any trach care or suctioning. We want to have our suction available in the event that we need to suction the patient during the procedure as well. We need to have an extra tracheostomy tube and a pair of hemostats at the patient's bedside in the event that something happens and it becomes dislodged during the procedure. Always explain your procedure to the patient and ensure they understand prior to beginning any care. We want to hyperoxygenate the patient to ensure that oxygen sats stay good during tracheostomy care also. I'm going to don a pair of clean gloves and remove the patient's old dressing around the tracheostomy tube first. And we'll discard that, and then we'll be ready to begin care once we cleanse our hands. We always need to ensure that we have our sterile normal saline or sterile water. We need to ensure that this is not expired, and if it has been previously opened, we want to ensure that the label is legible and that it has been date, timed, and initialed, and everything is good. If it has been opened, we could always go ahead and open this and lip a small amount out of the beginning before we use. We need our tracheostomy cleaning care tray, and we're going to open this outward away from us during the procedure. We have our sterile gloves, and we're going to don sterile gloves before beginning any further. Once we have our sterile gloves on, we're going to go ahead and begin moving our stuff onto a sterile field. This is our sterile drape, so we're going to lay this out on our clean table to begin our procedure. Moving our supplies over without breaking sterility during this procedure as well. Now during this procedure, I will be using my dominant hand to pour my solution, and this will become a clean hand after the procedure, and this will remain my sterile hand. I'm going to pour my solution in all three bins. And then at this point, I am good to go ahead and remove the patient's inner cannula. I'm going to use my dominant hand to do that by removing the oxygen and removing the inner cannula by only touching the outside of the cannula and remaining the inside of this sterile as I remove. I'll place that into my cleaning solution and let that sit for just a minute. And I will use my sterile hand to pick up my brush, and I can go ahead and pick that back up by the top and clean with the sterile hand. Once you have cleaned the inner cannula, you toss your brush and you can sit this in to rinse. After you've let it rinse, you want to pick that back up, tap it over the side just a small amount. Your sterile hand has remained up and it is still sterile, so you can now get your little pieces to dry the inner cannula. And you'll discard that. And you have one more. You can dry the outer part of the cannula, maintaining sterility during the procedure. Now I want to replace the inner cannula by only touching the outside piece and inserting the sterile side back into the tracheostomy tube. I then will reapply the patient's oxygen so that they don't lose any oxygen saturation. I'm going to continue with my hand, my sterile hand, and I'm going to clean above the tracheostomy site and below the tracheostomy site. I will use the clean bin to wet my Q-tip, and I will clean above. We will toss this. I'll use a new Q-tip to clean below. Toss that. Then I have another Q-tip that I can use to clean the outer plate of the tracheostomy. And toss. If needed, we can use one of the sterile gauze to also clean the plate. And then we have another sterile gauze to dry the area. At this point, I want to go ahead and reapply my gauze around the tracheostomy tube. And I want to go ahead and put a new strap around the patient's head and tie each end prior to removing the old strap. Once I have both of the new ties in place and secured, I can remove the old strap and we can toss that in the trash and clean up our mess at that point. We can assess the patient and ensure that they are good. O2 sats are good, vital signs are good, and they are not in any distress. We always document the procedure and document how the patient tolerated. We'll lower the bed and remove all of our equipment, and that is the skill of tracheostomy care.